Shopko Optical.
Hello, everybody.
Hi.
I'm Sam. I'm the optical manager here at the Shopko Optical in Verona. I am OC certified and grew up in Orangeville, Illinois. I've worked at a couple of the different stores. I've actually been to 12 different stores, but worked full-time at 3 different ones. This is my 4th one now. And Dr. Willis.
Hi, I'm Dr. Nicole Willis. I'm the optometrist here at Shopko. I went to the University of Wisconsin-Madison, so not too far from, kind of where I started out. And then I went to the Illinois College of Optometry for optometry school, and I grew up in Economowoc, Wisconsin. I started out doing Shopko in Fort Atkinson and Beaver Dam, and now we just opened up the Verona location, so I just started here as well. So we're going to go ahead and kind of talk to you guys a little bit about vision and eye care, proper eyeglasses, healthy eyes, and everything like that. Can you guys hear me okay?
Yes.
Yes.
All right. So pretty much in this presentation, we're going to discuss the different components of vision and eye diseases. A big part of what I do as an optometrist is screen for eye conditions and make sure that patients have up-to-date glasses prescriptions. So as you can see here, vision is more than just glasses. It's also proper glasses and healthy eyes. So what are proper glasses? The most important aspect of having good vision is having an updated prescription. So vision can change over time, and the right glasses can help you see a little bit better. Quality of lenses and correct measurements are equally important for good vision. Lenses that have low quality materials or that are measured incorrectly can actually blur the vision and reduce the quality of your vision. In addition to quality lenses, good anti-reflective coatings and everything are important for everyday situations, and they can reduce glare when driving and improve vision through lenses. So that's kind of a quick overview, but we'll get into a little bit more about healthy eyes because I feel like that's a pretty important part of vision and everything like that. So 20/20 is considered perfect vision. This is usually achieved with the help of glasses in most patients with healthy eyes. Sometimes we can develop different eye conditions that prevent us from having normal 20/20 vision or that perfect vision. Glasses can still improve vision in many cases. Can you guys still hear me? Oh,
yep.
Sorry, I'm getting some feedback. Glasses can still improve vision in most of these cases, but oftentimes other treatments can be required, which is why routine eye exams, coming in and seeing us or your local optometrist is important to screen for these conditions. So we'll go over some of the big ones that we see. So starting out, most common thing we see is presbyopia. So usually around the age 40, we start noticing that, we need maybe a little more magnification for reading. Presbyopia is just the term that we use for our focusing system when it starts to change, and the result is needing those reading glasses. This is something that people start to notice, like I said, kind of around the age of 40, and then it causes a gradual change in their reading prescription over time. This is a normal change, and we often prescribe what is called an add power to add magnification for near vision. Many people are familiar with bifocal lenses or lineless bifocals called progressives. So these glasses are designed to help with reading needs so we can still have clear distance vision on top, but also have that magnification on the bottom. Eye strain and blurry vision while reading can be due to not having enough magnification in your glasses. So at your routine eye exam, we usually perform special tests to determine how much magnification you need in your glasses and see if you're having any troubles with small print. We kind of try to help you out with that. All right, moving on here. So cataracts is a big one. I get a lot of questions about cataracts. I always tell my patients, if you live long enough, you'll eventually develop a cataract. They usually happen in both eyes, kind of at the same pace, but sometimes one eye can progress a little bit faster than the other. A cataract happens when the lens inside the eye, I don't know if they can see my mouse here.
Can you see the mouse moving?
Yes. Yeah.
So we have a lens inside our eye here. A cataract develops in this lens, and it happens when the lens starts to get a little bit cloudy. A cloudy lens can make your vision a little bit blurry and can cause trouble with glare, halos, and make daily activities such as driving or reading kind of difficult. What we do to be able to take care of the cataracts is the cloudy lens can actually be removed, and they can replace it with a clear lens transplant. So here's some stuff about what we see when I look at your eyes and I'm evaluating for cataracts. You can see this first image here. It's nice and clear. you see a nice white lens going into that eye, and that is, what we look for. Right here in the second image, you can see just a little bit of yellowing starting in that lens. So that yellowing, it can actually cause those blur, the glare, the halos, everything like that. And cataracts can actually develop in multiple areas within your eye. They can sort of cause some spoking and cause a little bit more glare, halos, everything like that. So what we do for your annual eye exam is when we put the dilating drops in, we take a peek and we grade the level of these cataracts, and we see if it's reducing your vision a lot or if it's time for surgery or something like that. And what's cool is if you have a little bit of blurriness, they actually take out that lens inside of your eye and they replace it with a lens that kind of looks like this. So it's a nice clear lens. Usually it corrects for glasses prescription too. So a lot of patients end up having really good vision after this. So just one of the things we look at during routine eye exams is evaluating for these cataracts and seeing, if you're ready for surgery or if it's time for that, or if we can still help you out with a pair of glasses. Let's see. Another big one that we usually see and that patients are often concerned about is macular degeneration. So macular degeneration impacts our central vision. It's inside of our eye, we have, the eye has a bunch of pumps and it brings in nutrients and it pumps out waste. So essentially what happens in macular degeneration is those pumps, they sort of slow down and you actually get little buildups in the back of your eye. And these buildups, they're called drusen. And these drusen, they can actually block out parts of your vision. So if you do have macular degeneration, you can see it causes some loss in that central vision. Things might be blurry. It can be hard to identify faces and read and different things like that. So it's important to have macular degeneration monitored because it can have, if it gets a little bit more severe, it can require some additional treatments. So here's kind of some basic eye anatomy here. You can see the macula, which is the area of the central vision, which macular degeneration impacts. And the fovea is a very, very central part of our vision. And what happens with macular degeneration is you've got these drusen. So you get these sort of yellow deposits in there that blocks out the vision. So it's very important every year, your doctor can monitor for macular degeneration, see if there's any of these lumps or bumps kind of starting back there and make sure that they're not causing any more problems. Sometimes we can start you on a vitamin supplement. Sometimes it requires, different interventions. Another big one that people talk about is glaucoma. So what happens with glaucoma is it's a disease of the optic nerve. So essentially it causes gradual loss of your peripheral vision. So every year at your annual eye exam, what we do is we monitor the eye pressures. So high eye pressures, they can be related to glaucoma and they can impact that optic nerve. So what we do is we check eye pressures and we also evaluate the optic nerve. Usually we dilate the eyes or we take a look. Oftentimes we have retinal photos that we can do as well. So we actually grade the optic nerve size and we look at all the tissue around the optic nerve and make sure that it's not causing any areas of thinning or changes. We also check the drainage system inside your eye and make sure that it's nice and open and that there aren't any blockages. So just all parts of routine eye exams. I'll kind of give you a little example here with glaucoma. So you see the optic disc here, that's the center, and then there's the optic cup, and it's sort of shaped like a donut. So this is a pretty normal, healthy eye again. And if we move to this picture, you can see that donut hole in the center gets excavated. So some of this tissue around here in the optic nerve actually starts thinning and sort of dying off, and that causes changes in your peripheral vision. So every year we monitor eye pressures and we look at these optic nerves, we grade them, and if we have photos of them, we can see if there's any changes over time. And it's important to monitor for this. Occasionally, if high eye pressures are high enough, we will send you out for referrals. Sometimes they'll do additional scans and occasionally put you on an eye drop if it's severe enough. So let's see here, diabetic eye exams. So another big thing that can impact the health inside the eyes is diabetes. So usually what can happen is the blood vessels inside the eyes, they start to leak. And diabetes is a vascular disorder. So usually what we say is if they're leaking inside your eye, they're leaking in other places inside your body. So it's a really good place because the retina is the only place that we can directly visualize blood vessels. And diabetes, aside from leaks and bleeds inside the eyes, it can also cause vision to fluctuate. It can change your glasses prescription. So we usually recommend diabetic eye exams at least once a year. If you're pre-diabetic, if you have diabetes or are at risk for diabetes or have a family history of it. So we usually like to do a dilated eye exam and make sure that there's no leaks or bleeds or anything like that. So here's kind of a good picture that I like. Normal retina again over here, and then you can see this one here. There's actually fatty deposits that are leaking out of the blood vessels as well as blood. And what can happen is you can get abnormal blood vessel growth or swelling in that central vision, and that can cause various stages of vision loss. And we also take care of other eye diseases, very commonly dry eyes, especially this time of year with all the cold, eye allergies, red eyes if you have any sort of irritation. You know, we look at different retinal disorders if you have a new floater, if you have a freckle, if you have, you know, signs of a retinal detachment or any sort of thinning in the retina. We look at all of that and just give you kind of that overall health checkup to make sure that nothing else is going on. And we can also check out for different disorders on the front surface of the eye. But we do a lot of pretty good dry eye treatments, allergies. You know, we can prescribe different medications and stuff too at your eye exam. So if you're really having any sort of troubles at all, yearly eye exams are a pretty good way to help out with those. At our office and many offices, they do digital retinal photos. So it's really cool. You get a picture of the back of your eye like this. It shows us right away if there's any problems, if there's any of those leaks, bleeds, signs of macular degeneration, or any of those things that I was mentioning before. And we can also track the optic nerve, and we can track things inside the eye for changes. So it's a very good permanent health record that a lot of offices offer to be able to see if there's any changes or problems or anything like that. And then referrals. So if there is something going on, you know, lots of things we can take care of in office or remonitor, but sometimes if you have a cataract, or you have more severe looking glaucoma or macular degeneration, we can usually send you out, and we usually refer to an ophthalmology clinic, and they can do additional treatments, surgeries, whatever it may be to be able to take care of your eyes and keep everything nice and healthy. But we're sort of, as optometrists, the front line, we take care, we, you know, screen for all these things and get you to the right place. Because sometimes, you know, glasses are half the story. We can get you a good pair of glasses, but more serious conditions, you know, we monitor for and make sure that we get treated. So your vision needs, so this is kind of where we come in. Our big thing is making sure that you have good lenses and good glasses, and that we help you out the best we can with your vision. Even if you have other health conditions, a lot of people still really depend on glasses for distance and reading and driving. So there's lots of, you know, full-time glasses, which are those progressive lenses with the bifocals or the lineless bifocals. You know, if driving is your main focus, we have lenses that are optimized for driving, whether or not you do driving only or you have a little bit of reading power magnification added in. I know a lot of people were starting to do a lot more computer use nowadays or office use. So there's different lenses kind of customized for that. Reading glasses, and again, I know I had mentioned before the anti-reflective coating, very important for just that visual clarity and everything. So when you come in for appointments with your optometrist, you know, we can work with you and kind of find a way to help your visual needs. Even if you do have some of these health conditions like cataracts or something where vision's a little blurry, we can still help you out usually and get a good pair of glasses for you. And let's see. So again, kind of wrapping it up with everything, vision is more than just, you know, proper glasses. It's a good component, but it's also a lot of healthy eyes here. So I hope that this presentation provided you with some useful information about glasses, kind of suiting your visual needs, eye health, and most importantly, the importance of yearly eye exams. Let's see here. That sort of wraps it up for you guys. Does anyone have any questions?
Yeah, are there some exercises you can do for your eyes when you're on the computer a lot to relax them?
Yeah, so we call this, it's called ocular hygiene is the technical term, and we use the 20-20-20 rule. So so when we look at the computer, our eyes, they use some muscles to focus, and so it can cause a little bit of eye strain. So to relax those muscles, what I tell people is every 20 minutes, look 20 feet away for 20 seconds. So, you know, look outside, take a break, make sure that those eyes have time to relax. And then, you know, you can look at devices again, but it just really is about relaxing that focusing system and not overstraining the eyes.
Thank you. Also, also, is there any foods you can take to prevent macular degeneration and glaucoma, since my mother had them, but at a later age, but.
Yeah, so foods, there's nothing that can really prevent glaucoma. That one usually tends to be a little more genetic, but as far as macular degeneration goes, leafy greens, omega-3 fatty acids, if you take a supplement called lutein, that can be pretty helpful as well. I know they offer those vitamins, the Preservision. Usually that's indicated once you have signs of macular degeneration yourself. But usually, you know, just the leafy greens, purple fruits is another one, anything high in antioxidants, omega-3 fatty acids.
What is in purple fruits and what type of fruits, like purple grapes?
Yeah, grapes, blueberries, strawberries,
What's
any of
in
those
that?
kind of super fruits.
What's in it? What's specifically in purple fruit of affects your macula?
So they're pretty high in antioxidants,
Oh,
which
okay.
can help those cellular processes from slowing down and building up those drusen.
Oh, okay.
I have a question about the glaucoma screening.
Yeah.
What kind of tool do you use for that? Because I had a problem on my last eye exam. They were using a handheld thing and they could not take a reading on me because I just flinched when I saw that thing coming toward my eyeball.
Yeah, so there's a couple different ways that we can use for doing readings. We have a non-contact device, so it doesn't touch your eye itself. It's just a little puff of air. There's also other methods called Goldman tonometry, where you put a little eye drop in and it numbs the eye, and then we're able to take pressures that way. So it depends, you know, if patients have troubles with the air puff or something touching their eyes, sometimes we do a little further investigation with the numbing drops or something like that.
Okay, thank you very much.
What are high eye pressure numbers that indicate glaucoma?
Yeah, so the average range of eye pressures is usually between 10 and 21. And patients can have high eye pressures for multiple reasons. Sometimes it's just genetic. Sometimes there can be something blocking the drainage system in the eyes. Sometimes it can be because the front surface of their eye is a little bit thicker, so it gives a higher measurement. So usually when I see pressures that are above 21 or above 22, then I start getting a little bit more concerned about glaucoma. And then I evaluate the drainage system and really look at the optic nerve and see if are any signs of thinning or anything in that nerve.
Oh, okay. Also, sometimes you get a field test. I know I've had my glaucoma, I think it was last time 13, but I know you get a field test too. I've had that. Can you have normal eye pressure numbers and yet not have good field tests? And what does that indicate glaucoma, or what's the field test about?
So you can have normal tension glaucoma as well. And by that, I mean, eye pressures are within the normal range. They're in that 10 to 21 range, but you still have glaucoma. So high eye pressures don't necessarily cause glaucoma, but they are related to glaucoma. So that visual field test, what it does, when the pressures in the back of the eye or the optic nerve itself is getting damaged for other reasons, parts of that nerve, they actually start to die off. And then that causes loss to your peripheral vision. So when they do that visual field test, even if you have normal eye pressures and everything, it can still show up, you know, little signs of changes in that optic nerve or areas where that optic nerve may be thinning or some of those nerve axons are sort of dying off or something like that.
What exactly is a field test?
Yeah, so in layman's terms, it's essentially checking the peripheral vision. But in more complicated terms, what it does is it pinpoints various spots inside your eye on the retina, and it looks and it shows you various degrees of light and finds the lowest level of light you can see. So it's testing retinal sensitivity at various locations.
And is it a machine, or what is it? What kind of thing is used to do that?
Yeah, so it's pretty much a big machine, and you stick your head in it and you click a button. It's sort of like a video game for that visual field.
Okay, gotcha. Because I know they've done the you know, how far back can you see my finger? But I've never had the stick your head in the machine kind. That sounds like fun.
Yeah, that just easily cheating.
It just flashes lights all over, and then whenever you see the lights, you click the button, and then it determines where you can't see that light, and then creates a chart printout that the doctor looks at to see which lights you could and couldn't see.
Okay, gotcha.
it's almost, you can cheat on that test, unknowingly, because you don't want to, that's the problem with that test.
It does let us know if you're cheating on it. So it actually tracks your eye, and we all have a blind spot in our eye, so it maps things out. So we are able to tell if you're cheating on the test.
Yeah.
Oh,
Sometimes you think you're cheating, but you're not sure if you're cheating. You know what I mean?
Usually we repeat it a couple times to double check.
Oh, okay. Thank you.
And we can see your eyeball to make sure you're lined up too, so we know if you're moving it before it even prints the report.
Yeah, I haven't had it for a while, but I remember getting it a couple of times. Yeah. How can we, you didn't talk about detached retina. I'm very nearsighted. What are signs of detached retina? I know they told me if you ever see a curtain to let them know. Is that the only way you know, basically? Like if you develop it, you see half or something?
Yeah, so I usually tell patients a curtain or veil over their vision. If you get a large increase in floaters, so you just kind of see a lot of black spots sort of floating around inside the eye, and then flashes. And usually these flashes will be one side, one eye, and pretty significant. Some patients can get ocular migraines where you're having sort of flashes in both eyes, and that's a little more common. But if you're getting flashes of light in one eye and that shower of floaters and a curtain or veil over the vision, that's usually pretty telltale sign for a retinal detachment.
Oh, okay, I didn't know in one eye. Yeah. Okay.
okay.
Does anyone else have any other questions?
No other questions.
I had to step out for just a minute. This is Stephanie again. Did you talk about how people can get a hold of your clinic and your availability this pandemic time?
So right now, our normal business hours is what we're open Monday through Friday, 9 to 7, Saturdays, 9 to 3. Dr. Avulis works Tuesdays, 10 to 6 would be our doctor hours. Wednesday, Thursday, Friday, 9 to 5. And then opposite Saturdays and Mondays. So if she's here Monday, she's here 9 to 5. If she's here Saturday, she's here 10 to 2. If you have a current prescription from somewhere else and you're just wanting to get glasses, that we can do anytime that we're open. Our phone number, we did not create a slide with that to put up for you, but I can give that to you.
Yeah.
Our phone number is 608-653-6218.
Okay. 608-653-6218. Thank you.
Yes, and we are on Hometown Circle, right across the street from where Farm and Fleet is in Verona, and the address is 631 Hometown Circle. Right now with COVID, we are highly recommending appointments because if we do have too many people in here that we cannot maintain, adequate social distancing between people, we would have to turn people away. It's only happened to us a couple of times. We have quite a bit of room in here, but we have had a couple of times that we've had to turn people away. So I do recommend giving a call to schedule an appointment ahead of time. We also clean everything in between every person, and require masks. We do temperature checks and ask questions at the door right now.
Okay.
That's great. Thank you so much.
Oh, I have a question. Sometimes you see a blue bulb, like a little blue bulb in my vision. What is that? I know it's aging of the retina, but do you have any ideas on that?
Yeah, so, you know, sometimes we can have different subjective visual experiences. I would say to tell you for certain, that'd be something I'd have to look at inside your eye. Sometimes we can get little visual auras or something like that, but it depends also on your history and everything too.
Oh, okay. One other thing, I have blue tinted glasses. I don't know how good that is for my everyday. I decided when I needed new glasses to get them blue tinted, you know, which is supposed to be good for the computer, but I put in everyday glasses. Is that a problem? I notice occasionally when I look down, I'll see blue. I think that has something to do with the glasses, but is that a good idea to get your everyday glasses tinted blue or just the computer ones tinted blue?
So the blue tint is fine to use for everyday use. You know, a lot of people find that it helps them with visual clarity or kind of reducing the troubles at the computer, but it's not going to do any harm for you if you're having it full time as well.
Okay. Thank you.
Yeah, thanks a lot for that.
Absolutely. Anybody have any other questions?
I don't.
No, I guess not. Thank you. I appreciate the info.
Yes, very much.
Well, this is great. And for everybody on the call, we will put this on our YouTube page. This is a lot of good information. So if you want to refer back to it, it'll be on the YouTube page, probably by Monday.
All right, thank you.
Yeah, well, thank you so much for our speakers today. And I hope everybody has a great day.
Thank you.
Yeah, you guys
You
too.
too.
Thanks for having us.
Yeah, thank you.
Bye.